The first coronavirus case in Norway was registered in a resident of Tromsø on 26 February. The individual had recently returned from China. They were not seriously ill and were placed under home quarantine. Many of the early cases were recorded in the Oslo region. This includes 6 employees of Oslo Ullevål Hospital, as revealed by Aftenposten. The first employee of the hospital's ICE department had recently returned from northern Italy. The outpatient clinic at the eye department is now closed, but the hospital itself remains open. However, hundreds of staff are quarantined at home for at least 14 days. It's important to state that at the time of writing, no patients of the hospital have tested positive for the virus. Although no one has yet died of the virus in Norway, we have seen the first serious cases requiring patients to be hospitalized. The regions around Bergen and Oslo, including Viken County, are hardest hit so far, although Trøndelag, central of Norway, has also recorded a high number of cases. The increasing proportion of infections contacted within Norway is made more likely by the fact that most of those infected are not seriously ill. A spokesperson for the Institute for Public Health confirmed that people suffering from only mild symptoms may help the virus spread unnoticed. More than 700 people have been infected in Norway, a number that has drastically increased in the last 48 hours. Although, at the time of writing, no one has yet died in Norway from the disease, the country's leader says this is inevitable. Announced by Erna Solberg yesterday, Norway is essentially shutting itself down for 2 weeks in a bid to stop the rapid spread of the coronavirus and COVID-19 disease. Schools and universities closed. The Norwegian Directorate of Health has decided to close all schools ranging from kindergartens through to universities. The closure is valid from 6 p.m. yesterday, Thursday 12th of March, through to Thursday 26th of March. However, it was emphasized at the press conference that this measure could be extended if required. Solberg said that employees should not call on elderly relatives for help with child care. We must remind you who we should be most looking out for. We should therefore not hand over child care to grandparents who are in the highest risk category. There will be a care offer available for very young children with parents in social critical functions. Events banned. Acting under Norway's Communicable Diseases Act, the Directorate of Health has announced the closure of cultural events, sports events, and organized sports activities both indoors and outdoors. Establishment in the hospitality industry except for places where food is served that can allow visitors stay at least 1 meter away, such as canteens. Food should not be served as buffet. The hospitality industry includes restaurants, bars, pubs, and nightlife, gyms, companies that offer hairdressing services, skincare, massage and body care, tattooing, piercing, etc., swimming pools, and water parks. But supermarkets will remain open. It isn't clear, however, exactly how people under home quarantine are expected to get there. Solberg admitted that the measures are very drastic and that Norway will go at a very slow pace over the coming 14 days. It is extremely important that people follow this advice. She also said that we need everyone to come together to be able to curb this. Several companies are also requiring employees to work from home for a period of 14 days if they have recently returned from international travel to affected areas. The government discourages all travel that is not strictly necessary, Anyone who has traveled outside the Nordic region, Sweden, Denmark, Finland, Iceland, and even within Norway, since February 27 must stay at home for 14 days from when they return to Norway. This applies regardless of your health. Norway has entered the new phase of pandemic where the spread of coronavirus can no longer be tracked. Yesterday morning, the European Center for Disease Prevention and Control has issued recommendation that all countries should now implement these types of measures, and they work best when implemented across our continent.